nerves passing through the foramens. Here actually olfactory nerve, first cranial nerve, that is lodging here. There is no foramen. What you are seeing in the base of the brain region, already I shown that how the olfactory nerve and olfactory bulb is there. So that is the only one cranial nerve not passing through the foramens. This is the second cranial nerve, optic nerve. Second cranial nerve, optic nerve. See, here individual nerves we are seeing, right side optic nerve, left side optic nerve is there. But in the base of the brain region we are finding the optic chiasma is there. How the right side cranial nerve going to cross to the towards the left side goes to the right side. This is a second cranial. And also here we can identify the internal carotid arteries also present here. Internal carotid arteries. This is the pituitary fossa. Here already we are removed pituitary gland. Next, this is the third cranial nerve. See here. This is the third cranial nerve. It is in relation with the cavernous sinus. In the textbook, see, this is the third cranial nerve. It is in relation with the cavernous sinus. Next, fourth cranial nerve not visible here. I was shown in the base of the brain. Next, this is the fifth cranial nerve. See, this is the fifth cranial nerve. If you remove this cavernous sinus here, we can identify how it make a ganglia. See here, this is the ganglia. After remove this cavernous sinus, here all fibers. This is the ganglia is here. That is present in the cavum trigeminale. This area fossa is known as the cavum trigeminale. Next, this is the sixth cranial nerve. See here. Here and here also the small part. These two are the sixth cranial nerves. Next here, this is the internal acoustic meatus foramen. Here seventh and eighth cranial nerves are there. Two are. This is the seventh and eighth cranial nerves. Below we can identify the jugular foramen. Jugular foramen. These are 9th, 10th, 11th cranial nerves. 9th, 10th, 11th cranial nerve. This is the spinal part of the accessory nerve. Here clearly visible how the spinal part is coming. See here, this is the spinal part of the accessory nerve. So next, 12th cranial nerve. So 9th, 10th, 11th passing through the jugular foramen. 7th and 8th passing through the internal acoustic meatus. Next, 12th cranial nerve here. See, this is one minute. After lifting this vertebral artery, here 12th cranial nerve is there. 12th cranial nerve. How it is passing? Hypoglossal canal, hypoglossal foramen. So this is the 12th cranial nerve passing through the hypoglossal canal through the jugular foramen, 9th, 10th, 11th cranial nerves, through the internal acoustic meatus, 7th and 8th cranial nerves. This is the 6th cranial nerves. This is the 5th cranial nerve. 4th is not visible here. This is the 3rd cranial nerve. 3rd cranial nerve. See here, after lifting this. This is the 3rd cranial. Now this is the 2nd cranial nerve, optic nerve. First is not visible here. We can identify the fossa for the bulb of the olfactory fossa, olfactory bulb. This is the fossa for olfactory nerve. Olfactory bulb is lodging here. This is the cribriform plate of ethmoid bone, sieve-like structure. This is the crista galli, tooth-like, dentate-like crista galli. Here frontal crest. This is attached by the falx cerebrum. See here, sickle-shaped structure. Sickle-shaped structure. See, after this is entire between the two cerebral hemispheres separating. After cutting from the frontal crest, we are finding like this. So inside this, we can identify here superior sagittal sinus, inferior sagittal sinus. Then here, straight sinus. See, this is the straight sinus. Here, next here, transverse sinus, then sigmoid sinus. Just see here, this is the transverse sinus. This is a sigmoid sinus. Then continuation as a internal jugular vein enter into the posterior part of the jugular foramen. Continuation passing through this foramen enter into the neck region. These are the structures passing through the foramens. This is the anterior cranial fossa. Anterior cranial fossa. It is mainly formed by the frontal bones. This is the cribriform, that is a ethmoid bone. This is the body of the sphenoid bone, pituitary fossa. Butterfly shape it is look like. This is the middle cranial fossa. These are the middle cranial fossa. This is the posterior cranial fossa, mainly formed by this occipital bone. So posterior cranial fossa, middle cranial fossa. This is the frontal cranial. So anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Here frontal lobe of the frontal pole of the frontal lobes of the cerebrum lodging here. Temporal poles of the temporal lobes of the cerebrum lodging here. Here occipital lobes of the cerebrum is lodging in the posterior cranial fossa. And also here two marked rounded fossa for the lodging for the two cerebellar hemispheres. The continuous, see here inside spinal cord. After cutting this we are separating inside. Next, this is the vertebral artery. Vertebral arteries. This is the vertebral artery.